A new report states that governments are dangerously underspending on non-communicable disease, urging nations to boost health investments. Jove Francisco reports.
Heart attack, stroke, cancer, asthma, diabetes. These are some NCDs or non-communicable diseases that continue to claim lives worldwide. In fact, these NCDs that target major organs of the human body account for almost 75% of all deaths worldwide. And NCDs disproportionately affect low and middle income countries. Treatment and management of these diseases remain unaffordable in many territories. The NCD Alliance recently published a report sounding the alarm that countries are dangerously underspending on addressing non-communicable diseases. Currently, most countries invest at best just 0.46% of their gross national income to battle NCDs, even if these diseases claim so many lives each year. The group's recommendation: achieve universal coverage and provide financial protection for NCD interventions by spending up to 1.7% of their national budget.
And I just want to put that in context. Around 1.3 billion people have been pushed into or pushed further into poverty by out-of-pocket health spending. We know that NCD care is driving household poverty and undermining economies. So that's why we think these targets are so important.
Here in the Philippines, a universal healthcare coverage exists, but funding should be allocated strategically and wisely.
It's interesting because as a country, Philippines delivers health insurance to all and principal access to health services to all. But still you have utilization of basic primary care services for NCDs that is quite low. So you still have this massive gap, even in a country that's committed to universal coverage and is committed to financing the health system, big gaps in implementation. And that's, not all the government's fault. Sometimes it just takes time to build awareness in the community. But this is really where the financing solutions lies in generating population demand for more services and pressuring governments to spend more to deliver those basic services.
In 2 weeks, a high-level meeting on NCD and mental health will start at the UN headquarters in New York. Groups are now pushing countries to commit to closing the financing gaps in programs dealing with specific deadly diseases. Jove Francisco, we are One News.